Good afternoon, friends. I think we go ahead and try to apply what Dr. Manoj and Dr. Bipin focused on the general concepts and how do we tackle a problem. So here right now we are going to deal with the organizing homeopathic services for mother and child segment. Why the mother and child segment? Because they are the most deprived lot. Whenever we go into the community, one thing is very important is that we need to communicate with the community and identify through them what the problem is. We have realized most of the public health programs do not actually get implemented because the communication between the community and the program implementer is lacking. So what we have done is that we have tried to conduct surveys and village health meetings. The surveys are organized with the help of the MSW colleges, who are specialized in conducting community surveys. So they conduct surveys, we find out data from the community. The surveys have to be conducted at night. We have to interact with the community at night because that's when the community is present in the village. What did we find when we interacted with them related to the mother and child health problem? We found about mostly 90 to 100% deliveries occur at home. Why do they occur at home? Because it's easy, it's convenient, because the lady is supposed to carry the baby for 9 months, deliver, take a day's rest, go back to work. So naturally the home is the best place to do that. ANC, concept of an ANC is negligible. You ask a mother, a tribal mother, she says, why do I need to check myself up for 9 months? I don't think there's any need. A gross conceptual as well as a cultural problem and a social issue. So naturally the mother and child both are deprived right from the time of conception. Geographically we are working in areas where there are times when we cannot reach them, especially during monsoon. There will be knee-deep water all around the village, so a pregnant lady just cannot come out of the village. So how will you reach them? So how will they reach a hospital? So such is the area which we had picked up. Medical facilities are poor, and homeopathy, I don't know whether they even know. Slowly they have started knowing Sabudana ka small goli. They don't know anything about homeopathy. That was the state in which we got an idea. So what issues we were able to realize when we got this data is that real issues related to the community was one, but we also realized that the physicians who will go there will have issues and the organization. Issues of the community are health practices, ANC care, no idea, diet and nutrition is a big issue, hygiene is an issue, social problem because they are deprived, cultural traditional practices, poverty is a big issue, underdeveloped, transport and communication. Communication is a big thing, language barrier is there and their idea of health and our idea of health is an issue. There is a gap in that. Physician issue. We as a group of physicians, we are coming from an urban background and when we want to do something to them, we have our own ideas of health and disease. So, but when we try to interact with them, they find that our concepts are different. So then there is a big gap between the physician's concept and the community's concept. Language is an issue. Case-taking skills. For homeopath, that's a big issue. How do you try to define a patient so that you get the constitution of the patient in 3 minutes, 5 minutes? These are the issues. Emotional distancing. We realized that many times, whatever problems the patients used to face, the physicians felt totally at a distance in being able to even understand and accept what that problem was. They felt that it is not a problem. They would tell the lady, why can't you tell your mother-in-law that I need rest? That lady is just looking at her. How can I tell my mother-in-law that I need rest? It's not possible. But a young enthusiastic physician, urban trained physician tries to tell this to the lady. Physical discomfort. See, the urban physician has to travel a long distance and reach. So that's a big problem. When he goes there, he may not get paid for doing that service. So economy is a big issue. For the organization, the problems which we face is that what is the concept, what is the model on which we are to provide? Are we to provide only services or certain other things also? So as an organization, are we ready to expand our concept and integrate homeopathy in it? Manpower, material, money is a big issue. Networking and administration are issues. Our guru had studied this. He realized that whenever we have to go, if we have to go, it is possible to succeed only if we accept and actively participate with the community. And so also vice versa, the community also has to accept and participate with us. Only then we would be able to have a successful program. So when we found what we found in this mother and child segment, we went back to the community with whatever we found. Mind you, it's very important. We cannot remain back with whatever data we have received and analyzed. We have to go back to them, tell them this is what we found in you. Do you accept that these are the issues? Only when we have a dialogue, then it is possible to design the health services and intervention. So due to this constant interaction with the community realized that these are people who want to come back to us, talk to us, and like to know our view of what type of services they need. So that's why slowly they started having faith in us. So then we designed the interventions. Mind you, again, all these interventions are designed with the community's participation. So we have outreach them primarily through this mobile health services, by which we go into their hamlets. While doing that, our homeopathic physician's need also needs to be taken care of. He takes cases under he takes it under a tree, he takes a case under open place, at home where there are 10 people around him and he is the lone person taking a case. Under these circumstances, the homeopathic physician has to get trained. Then we have to build, after we have built the outreach services, the need of a hospital came into place, and that's why a base hospital came into picture. Basic hospitals needed. Then we realized that how do we strategize the interventions which are there. So we identified focused interventions. Here we found that the role of the medical social worker was very important. Training of CHVs, as Dr. Pipin has already pointed. Training, orienting and sensitizing the physicians. This was a very important role. So we used to have sessions for our physicians so that they could understand. They could come down from the urban to the rural, tribal, understand the person primarily. Taking care of the resident medical officer. Mind you, we were lucky that Dr. Mohammed Syed, who is with us, after finishing his MD, he was there with us for the last 4 years, and he has agreed for a long-term commitment. Due to his presence in the hospital, there was a sea change in the community looking at the organization. We also were very firm on thinking and insisting that we will give only homeopathic services. They wanted injections. We said no, we are prepared for giving homeopathic medicines. Our firmness gradually allowed them to accept faith in us. They had first faith in us, then the pathy. Subsidizing. Most of the services which we give are free or very less cost. Liaising with government agencies so that the government programs can be listed. This is a very important CHV, as Dr. Bipin has already said. She is our bridge and change agent in the community. So we realized that our program needs to expand. What is the expansion? So we have health services, education and training, and livelihood. So we have to operate on self-help group, land and water, Warli arts, organic farming. All these had to become an encompassed part of the entire program. So this is how an emergence, holistic model got emerged. As you all aware, the impact of all this, if you see ANC registrations going up to 500%, where a lady, tribal lady, taking 9 months of ANC checkup, which is not heard of, due to which both the mother and the child, there is a difference. So you will see increase in hospital deliveries, and if you will see the children also. Birth weight, we made an assessment of the birth weight of children before our intervention and after our intervention. So earlier there used to be 2 and below 2, the birth weight. You can imagine what would happen to a 2 and below 2. Naturally IMR is more. So because of our intervention of simply being able to provide constitutional treatment and proper care of ANC, the birth weight of child came up to 2 to 2.5, 2.5 to 3, and now even above 3. So now if you have a child, tribal child above 3, IMR is going to be less. So less healthy child, less production of children. Again, because they used to produce more, because there will be more deaths. So what is the model? We have realized that this model has to be integrated, where the medical team has to be there, the community has to be involved, the government is to be involved, the change agent is involved, and mind you, don't forget, the beneficiary, that's the mother and child, is in the center. We have to keep the mother and child along with us whenever we are trying to plan health care for them. So we as a trust believed in care of the learner, of the patient, of the knowledge and community. Each required its own this thing. For the learner through goodwill and sadbhavana, for the patient through seva and service, for the knowledge through sadvichar, and for community through sahakar, that is participation and cooperation. So thus we became an NGO that cares. So this experiential learning forms a valuable backbone to mainstreaming homeopathy. We feel proud that we could initiate the process of lighting the homeopathic lamp in a small pocket of a tribal community, and were able to explore the wide application of homeopathic approach to integrated health and social development in the community.
Time is up, please.
All this was possible because of this team. This is our team at Bopoli, which is now operating in 25 villages, where I have my doctors, I have my physicians, I have my community health workers, and we also have representatives from the community. Thank you very much.